Hello and welcome to APTA's Fight the Cut virtual rally, where we're taking the fight to Medicare. Hi, I'm Justin Elliott, Vice President of Government Affairs at the American Physical Therapy Association. It's been a busy 24 hours as physical therapists, physical therapist assistants, and students and patients across the country have been sending comment letters to the Centers for Medicare and Medicaid Services, also known as CMS, opposing these proposed cuts. Now, we have a goal of hitting 30,000 letters to CMS before the Monday, October 5th deadline. And so far, we're at approximately 17,000 letters have been submitted to CMS. Now, today's rally is critical in making some noise with CMS about the proposed Medicare cuts slated to go into effect on January 1st. Now, as you know, a few weeks ago, we rallied to raise this issue with Congress, asking both the U.S. House and the United States Senate to intervene and stop these cuts from being implemented. Today's rally has been focusing our message to CMS, the federal agency responsible for issuing this proposal that is going to make significant cuts to over 35 provider groups: PTs, OTs, audiologists, pathologists, surgeons, radiologists, and more. We said it before and we'll say it again. Making cuts to healthcare during the middle of a global pandemic is reckless and irresponsible. And thanks to you, we're taking that message to CMS. Now, joining us live from Iowa is Dr. Sandy Norby. Dr. Norby is CEO and co-founder of Hometown Physical Therapy. And Sandy has served on many leadership positions in APTA and the private practice section, including the APTA Public Policy and Advocacy Committee, 2 terms as a director on the private practice board. And Sandy, Dr. Norby, is currently serving as president of APTA's private practice section. Welcome, Sandy. How are you doing?
Thanks, Justin. I'm doing great. I'm literally on the road for advocacy.
Well, we appreciate you taking time out of your busy schedule to join us this evening. And, you know, Sandy, when it comes to advocacy, you are a veteran. You have testified before the United States Congress a few times. You've been at meetings at CMS advocating for PT payment. Last month, you were meeting with Iowa Senator Chuck Grassley about these proposed cuts. I wanted to ask you, from your perspective, can you give us a peek behind the advocacy curtain? What has the last year looked like in terms of advocacy, for our members, and in particularly for our private practice members?
Thanks, Justin, for that question. It's definitely been a busy year. And as I reflected back, obviously the thing that is most on our minds right now is this arbitrary 9% cut to our payments for our Medicare patients, and is the focus of all of our energies right now. But the year has been busy. We've talked about telehealth, decreasing administrative burden for our therapists, and then the whole COVID package and all of the relief packages that the Congress put in, and making sure that we don't get arbitrary taxes on those as business owners. That was part of our discussion with Senator Grassley, who's chair of the Finance Committee for the Senate, and it was very important and powerful to be able to hear him say that we don't want to put those extra burdens on the small business owners who we wanted to help out during the COVID-19 pandemic.
Sandy, I think looking at this whole proposal, the 9% cut, we've been advocating with Congress, but the focus this week has been really focusing our comments at CMS, the federal agency that came up with this proposal. That's going to impact so many patients and so many providers. Sandy, from your perspective, as a small business owner, as a leader with our members, and as a president of the private practice section, this final push to get comments to CMS, why is that important now for our physical therapy members, for our community, and for patients? What is your take on this? Why is this important?
It's our right as Americans to have a voice, to be able to tell those that make the decisions, especially in this case with the Medicare fee schedule and the cuts, that it's really impactful. I think, there's people that they have this to make this balanced budget. It has to be budget neutral. And so they're trying to do a balancing act to improve payment for maybe family practice physicians to entice them to go into that field to serve people in America, especially rural America where we live. But why do that on the backs of the other people in our profession that are so critical to the health and wellness of the seniors? There's PT practice owners that are one clinic to hundreds of clinics, and when you talk about a profit margin of maybe less than 9%, this 9% cut is going to be so detrimental for practice owners to be able to be open in communities that are underserved the way it is. And so what's going to happen is there's going to be less access to care for our seniors. And so what does that mean? Now they're going to have more prescription medications. They're going to have a higher fall risk. There may be more surgeries, and that's not where we want this all to go. So we just want to make those people aware, the CMS people that are making these decisions, on the impact of real life Americans, our seniors in our neighborhoods, and the people that we care for, and how detrimental these cuts will be for us.
Well, Dr. Norby, I want to say again, thank you for taking time out of your busy schedule. You are literally on the road for advocacy. And also, you brought up a good point about the impact that this is going to have in rural and underserved areas in places like Iowa. So Sandy, thank you so much. It's great to see you. Thank you for all that you do for the PT profession. And we're going to keep fighting. And for those who have not done so already, remember the deadline to submit your comments to CMS is this Monday, October 5th. Tell your friends, tell your colleagues, tell your family members, tell your patients, tell your neighbors. Let's make some noise with CMS, and we're going to fight the cut. And remember, you can go to apta.org/fight the cut. Everything you need to know is right there. We have a template letter that you can utilize to send to CMS. And of course, if you're on social media, join us at #FightTheCut. Thank you for joining us this evening. Thank you for your advocacy, and thank you for being members of APTA.